Mental status examination. It includes the following: appearance and behavior, speech, emotion, perception, thought content, insight and judgment, and cognition. The mnemonic aseptic, that is A, S, E, P, T, I, C. It can be used to remember the components of the mental status examination. Today we will look into the details of the component emotion, that includes mood and affect. Other components of the mental status examination will be discussed in the coming videos, so please subscribe to the channel. Mood and affect. Mood is reported by the client, whereas affect is observed by the clinician or the interviewer. Mood can be distinguished from affect on the basis of several features. Mood tends to last longer than affect. Mood changes less spontaneously than affect. It constitutes the emotional background, and affect is momentary. It is like weather, and mood is prolonged emotion. So it is like climate. Mood, as I said, it is like climate and it is prolonged. It is the client's self-report regarding his or her prevailing emotional state, and it is experienced over a period of time. Happiness. It can be euphoria, euthymia, or dysphoria. Euphoria is the exaggerated positive mood seen in mania and intoxication. Euthymia is the normal mood, neither expressed nor elevated. And dysphoria is the feeling of sadness. It is classically associated with depression. Then, reactivity of the mood. It can be reactive or non-reactive. In reactive mood, the mood brightens when good events occur, and it is a normal behavior. Non-reactive mood. The mood does not brighten at all, even when very good events occur. It is associated with depressive disorder. Irritability of the mood. It can be explosive, irritable, or calm. Explosive means outbursts of anger that are disproportionate to the situation. Irritable means agitation with minimal stimulus. And calm is the lack of agitation. And the causes of the irritability may be stress, anxiety, depression, mania, delirium, dementia, psychosis, and intoxication. And the assessment of the irritability is more useful in the context of assessing risk than for the diagnosis. Then comes stability of the mood. It can be stable or labile. Stable means the mood does not fluctuate. In labile mood, the mood fluctuates spontaneously with time of day or with environment. The causes of the labile mood, it can be mania, depression, psychosis, borderline personality disorder, delirium, or post-stroke disorder. Affect. It is like weather. Weather can change within minutes or hours. If in the morning it rains, afternoon it may be sunny. Likewise, the affect also changes rapidly, and it is a short-term feeling. It is assessed by observing a patient's posture, facial expression, emotional reactivity, and speech. Types of affect. It can be flattened or blunted. In flattened affect, limited range of emotion will be there and not to the point of apathy, and it is seen in mild to moderate depression. In blunted affect, it will be apathy and decreased intensity and small ranged affect. The patient does not express happiness or sadness and has no depth of conviction. It is seen in chronic schizophrenia and severe depression. Usually, this blunted and flattened affect are often used interchangeably. A range of affect. It can be restricted or expanded. Restricted, a spectrum of emotions is not elicitable. It is seen in depression, schizophrenia, antisocial personality disorder. And in expanded range of affect, the patient will show excessive joy, sadness or irritability, and it is seen in mania patients. Appropriateness of the affect. It can be appropriate, inappropriate, incongruous or fatuous. In appropriate, there will be a correlation between the content of speech and the accompanying emotional expression. In inappropriate, there will be lack of correlation between the content of speech and the accompanying emotional expression. For example, the patient may laugh while discussing depression, or the patient may cry while claiming to be happy. Then incongruous. The lack of correlation between the affect and the stated mood. The patient may claim to be depressed but without any flattened affect. While saying that he is depressed, he may laugh at jokes. Then fatuous. It is the inappropriate affect that is overly childlike. It is associated with hebephrenia. It may indicate an intellectual disability or represent an inappropriate coping mechanism as seen in eating disorder. Intensity of the affect. It can be increased, normal or decreased. In increased intensity of affect, the intense emotional expression with inflexibility in convictions, which may be accompanied by abusive statements. It is seen in bipolar affective disorder, cyclothymia, and borderline personality disorder. Normal. It shows appropriate intensity of emotional response. And in decreased intensity of affect, the apparent shallowness will be there with little conviction behind responses. A feature of flattened or blunted affect. And it is seen in depression or schizophrenia. Then stability of the affect. It can be stable, labile or incontinence. Stable means changes in mood that are relevant to the flow of conversation. In labile, the frequent shift will be there in emotional expressions. And in emotional incontinence, the lability will be extreme. Points to note. While taking the mood and affect during the mental status examination. As a part of the objective judgment of mood, the clinician should also note the presence or absence of biological symptoms, that is, the changes in the sleep pattern, loss of appetite. If present, then degree of the weight loss should be noted. Then concentration and libido, and note whether there is any diurnal variation of the mood. If a patient's mood is low, always screen for suicidal thoughts, then thoughts of self-harm or the thoughts of harming to others. If any of these do come up, remember that it is important to do a risk assessment in order to ensure the safety of the patient and the people around them. So, hope you like this video. Please subscribe the channel so you won't miss other components of the mental status examination that will be discussed in the coming videos. Thank you and keep smiling.